So we've shifted our focus a little bit here to more from ultrasound to phonophoresis. And phonophoresis is a treatment in which we can use ultrasound to drive a molecule of medication, and it could be for pain control, or it could be, in this case, we're going to use hydrocortisone cream, which is an anti-inflammatory. We're going to simulate the situation in which this gentleman may have tennis elbow or lateral epicondylitis. So again, when we start thinking about that versus the video that we just went over with the low back, the amount of muscle tissue or tissue in general that we have over the bone and over this area is significantly less. So when we start thinking about our treatment depth and how far we want to go, that needs to be part of our decision on what our parameters are. So in the actual setup for phonophoresis, whether I'm doing this on the elbow, shoulder, back, or wherever it might be, I will typically apply a small area about the size of a dime or a nickel right over that area. And then I will actually go through and really massage that in, right into the skin. Right into the area. I want to try and already rub as much of this as I can and just really get it covered and kind of rubbed into the skin, massaged into the skin as much as we can. Okay? And you can actually take this opportunity if you wanted to go in and do a little bit of cross-friction massage, to that area, or if you've got some other manual techniques that you're thinking about doing, or some tendon type stripping, you can use this as a little bit of an opportunity to incorporate several different treatment techniques. Once I've rubbed in as much as I want, I probably have a little bit more there than what we need, then I'm going to apply my ultrasound gel right over the top of that. Adjust my parameters, which I've already done, for the appropriate tissue depth, intensity. Again, in this situation, we are not after a thermal effect, so we have changed our duty cycle down to stay in that 10 to 20%. And again, we're going to go back, very similar treatment technique to the ultrasound, right? We want to stay at an area no bigger than double the size of the head. Once we start, the light should come on, and we're going to work on driving that medication right into the skin. If for some reason you need to stop, the machines almost all have a pause button on them. You always make sure that you pause and stop the ultrasound before you take and remove the head from the gel. The sound waves do not travel well through air. We'll talk about the mediums in which sound waves travel the best through. And so in the air like this, the sound waves, instead of traveling through the air, most of them get, the energy stays in the sound head, which can damage the sound head again.